Hi, this is John Edmonson, and this is the first recording of our Heart to Heart series. And what we're going to be talking about is how our emotional heart affects our physical heart and the psychology behind that, and some of the stats too as well. So I have Sarah here who's going to be helping me today, and I'm going to hand the camera over to her for the phone.
Hey guys, we're really excited for this Heart to Heart series. And as soon as I walked into the office here, I noticed something on the door. Could you show us?
Sure. So in all the rooms that we have is a reference to visualization. And what we're trying to do is really get people to think about visualizing the health they want and the life that they want, because both of those are very important. We spend all day thinking, we spend all day visualizing, but on what is the question? Here what we want to do is say visualize on your health. Think about your health all day long and what you want out of life. So part of that is we have these great tablets in all the rooms. And we can do lots of things with them. There's lots of educational videos that you can learn about yoga, mindfulness, and your health, and even diet just by looking at these while you're waiting to see the doctor. We even have an option on here that's for assessments. And we'll click on it maybe later on in the next video. But it'll talk about more than just your physical health, but your emotional health, because those two are related and connected. There are studies that people who've been diagnosed with heart disease or had procedures, 1 in 5 suffer from depression. They even have studies about how people who don't manage their stress are much more likely to have heart trouble than those who don't. And so those are the things we want to talk about here is first create that awareness, because we all kind of know, but we don't really do anything about it. And also talk about the things we can do to help you and that you can do for yourself as well. One of the big reasons where we're talking about the psychological component, the stress and anxiety is if it goes untreated, it's not just going to make you unhappy emotionally, it can affect you physically too. And so we want to address that. For example, if you have anxiety, then maybe your food choices are going to be the ones that are the most healthy for you. Maybe your heart rate's going to stay high, and you're not going to be able to really hear the advice of the doctor. But then also, you're not going to be able to follow it either because you have so much anxiety and stress going on. It's difficult to follow through. And I've been amazed when people come into our office, how much time we spend on the emotional part, not just the medical. And we think that it is so important because the outcomes are always going to be much better. So when you get a diagnosis, and it could be heart disease, for others it could be cancer, or it could be something, diabetes or something else, immediately you're going to go into a fight, flight, or freeze mode. Who doesn't? You're in shock. Some people may be relieved because, well, at least I know what's going on. But most people, even after that initial, well, at least I know, there's anxiety that goes with that. Because now what is my life going to be like? What do I have to do? How's this going to impact me? How long am I going to live? And all this goes through our minds. And in most cases, we say, thank you, doctor, and we go home and we stress about it on our own. And you don't have to do that. You can really find ways to deal with that. And it's okay to talk about it too. So, for example, in our office, we give assessments. We're going to be looking at anxiety, depression, and distress, and help people evaluate that. Because once we talk about it, and sometimes let them evaluate on their own so they don't have to talk about it, just take a test on a tablet first, and then we can go over it together. Now we can have an action plan. And for some people, it's just as simple as, I just need to get out the fact that I'm stressed about this. For some people, it's just, I need to share that I'm scared about the outcomes here. For others, it could be doing a mindfulness class, like the ones we offer here. You come in, maybe 2 or 3 classes, learn some approaches how to manage your stress, learn how to reduce your anxiety, so you can now really receive the information you need from the doctor. For others, maybe it's more severe. We're seeing that as people are coming in the rooms, high levels of depression, high levels of anxiety, and some of that was already there before, but now that they've had this diagnosis, it's bigger. And it's huge, and we have to deal with it. We don't want to keep that inside anymore, because the more you keep inside, the more it's going to affect your body, and it's going to affect the outcome of your health. So then it'd be being honest about it, and then looking at, well, is it time to see a therapist? And we offer therapy here sometimes to our patients, or refer out to a therapist you already know or feel comfortable with. Is it time for medication? It could be. Or in some cases, even both. We want to look at that. Because every case is going to be different. Every case is going to be individualized and designed for your health and your needs. So we're talking about this. If nothing else out of this recording today is knowing that the body and mind are connected, and it's okay to talk about your stress and anxiety around your illness. And also looking to deal with your stress and anxiety to help prevent illnesses that are coming up for you. Now, a lot of my friends, I sit with them and they say the same thing to me every time is, John, I don't want to come in and get my blood work done. I don't want to get a CT scan because I don't want to know. Are you kidding me? Well, of course, I know I'm the same way too. I got it. I was worried. But sometimes our stress and our anxiety is not just about some emotional issue from our past or our childhood. It's about lack of action and knowing we should do something. So if you're worried about your health, if you're worried about your heart, and you're worried about what you're going to be like in 10 years, you need to come see us. And you need to get your blood work done. And you need to get a CT scan of the heart so we can take a look and evaluate you and see how you are. And also, if you have a diagnosis and you're stressed about it, you need to deal with it. That may be coming to see us and getting an evaluation. We focus mostly on heart disease, but we also address the emotional part. Or it could be talking to someone about it and at least being honest with how you feel and your worries. You don't have to spend all day talking about it. You don't have to ruminate on it. But just at least getting out and saying, you know what, this is stressing me and I need to talk about it for a minute. It could really help you. And then your outcome's going to be better. Because when you're less stressed, when you're less worried, you can take care of yourself more and get back to enjoying life again. And there's hope. So even if you have a diagnosis, you can still find ways to enjoy life. And we want to talk more about that in our next video.